I'll go with the both of you first. Yeah.
Right. Getting to the issue of competition, I'm in a situation where our company's insurance costs just went up 20%. 20%. Wow. It's been going up at 5 to 10 times the rate of inflation for at least the last 10 years. And it all goes back to about 30 years worth of ignoring antitrust laws to me. And that has to do with the insurance companies, it has to do with the pharmaceutical companies, all of them coming down to where there once may have been 100 companies, now there are just a few. To me, that is the primary driver of costs to individuals and costs to the United States government. How do we find another Teddy Roosevelt to break the trusts?
I think the short answer is, bottom line, number one, we have a rock and roll and antitrust enforcement by the Justice Department, and number two, we do.
They haven't done anything for 30 years.
Right, and number two, you should be allowed to buy from any state in the union, and we should have complete.
So when we got this bill for a 20% increase,
right,
we went out and looked for other insurance, and that was the best we could find with the 20% increase.
Yeah, I think we have full and national competition in just about every other part of our economy, but not this one, and that's part of the problem.
How do we change that?
Interstate.
What's that?
My question centers really on what do you foresee as realistic opportunity to increase the efficiency of the FDA for the approval process of treatments, drugs, et cetera. I mean, there's a pretty standardized perception that there's a lot of inefficiency there.
It seems to be greatly inefficient, but briefly, let me introduce Dr. Fessler, who's wrestling with procedures already available overseas, but not in the United States.
Part of the reason this is a relevant question is because I just returned from South Africa, where I'm doing some research on a new medical device. And why would I travel so far to do research on a medical device? Because we can't do it in the United States. Within a year, this device will be available everywhere else in the world. It'll be 10 years before we get it here. Part of the reason for that is in order to get a new medical device invented, tested, developed, to the point where we can use it, it'll cost $100 million. Most of that is legal fees. So, in answer to your question, I think it's very important that we get our costs under control. We don't want to kill innovation. We are killing innovation in the United States right now, and we are losing the best devices to treat our own citizens because of the barriers we're putting up in this country.
Well, you heard I am for stem cell research and voted to back it. But I'm concerned that if you watch the field as much as I have, you've seen that many of the innovations have happened in other countries now. You know, we have been completely dominant in medical research. But that dominance is beginning to fade, and I want to make sure that it continues. We got a lot of other questions, but let me just say, we're going to go through 3 more questions, and then if I can ask you to be polite, there are a large number of our fellow Americans who are outside, and we are going to have the second town hall meeting. So I'll do 3 more questions, and then we'll wrap. If you could then give your seat to your fellow Americans who want to do the very same town hall meeting. We'll do that. And let me go right here. Adam.
Would you acknowledge the youth in the corner there? He's been raising his hand. I'd like to hear from the young people.
In TV, they call that a toss. Good job.
Well, I'd just like to say the reason I'm here today is because my dad asked me to come, and I was at the corner of junior high for my walkthrough, and I said, well, if I get the opportunity to be on television, I would like to go.
What's your name? Franklin. Meet the next congressman for the 10th congressional.
I would like you all to learn something, and it would do you good to listen to my dad. He's got some things to say, so I'd like to.
This is called a bank shot.
Hi, Congressman, thanks a million. We appreciate everything you're doing and trying to do, and I agree with you thoroughly. I don't think that Obama and the boys in D.C. are right to throw the baby out with the bathwater. I turned 65 in June, so I'm one of those old parts. I'm not a baby boomer, but I am old. And one of the things that I got in the mail kind of blew me away. It was an application for Medicaid, state of Illinois. On page 2, and I've got a copy here if you want to keep it, it clearly stated that my immigration status would not be used to withhold benefits. Now these are benefits for illegal immigrants under Medicaid, state of Illinois. I further would not have my food stamps withheld or any cash payments. Now I don't know who writes laws like this. I know Quinn is allegedly trying to balance the budget, but I'm sorry, I'm an American citizen. Some of the grandparents came through the Ellis Island, the rest were in the Civil War, and my son and daughter are never going to see anything that they're going to be forced to pay for. And as you said in one of your opening statements, we do not have 46 million uninsured Americans. We have 46 million uninsured people. We can only help those that are U.S. citizens. We give $100 million a year away to the IMF. We're giving 40 billion to the IMF. We pay about 86 billion to the UN. We gave 40 billion to Africa. We are the most charitable nation on this planet.
I think we are the most charitable nation on earth, not to mention the United States military that protects everyone. And last two right here.
Hello, my name is Christine Harriman, and you want to make sure the government stays out between me and the doctor. I need help from the insurance companies and the businesses to stay out between me and my doctor. I'm a male to female transsexual. Will your plan cover gender confirmation surgery?
No, I don't think it will. Okay, last question, and then we will give room to our fellow citizens who are waiting out.
Hi, my name is Susan Stevens, and my question to you is, I don't understand how the United States government is trying to afford to provide everyone with insurance coverage when that's not provided for us in the United States Constitution, which that gentleman has a copy of. It's actually provided for state by state, but the United States Constitution says that that's not a right that the federal government can take our money and give it to other people.
I believe it's my job to create a space of practical, bipartisan reforms that we can go forward, like the ones I talked about. That we don't have $1 trillion borrowing or tax increase, because that's not sustainable. We should not transfer that debt to our children. And my hope is, as we get to September, we can lower the temperature and come forward on some practical reforms to do what some states have done and to avoid everything New Jersey has done to make sure that we can lower the cost of health. Everybody, thank you for coming. We will do this again, and we could quickly bring in the next team.